Working with kids every day is probably the best part of my job. I see everybody from newborns to teenagers, and no two kids are the same. It's the thing I look forward to every time I wake up. I grab my cup of coffee and I come into work just excited to be here. One of the great parts of being at Weill Cornell Medicine and the Division of Pediatric Otolaryngology is that we didn't stop learning our last day of residency training or our last day of fellowship. We continue to push the envelope. We continue to be on the cutting edge of medicine. We're always learning, and we're always growing, and we're always trying to get better. In pediatric otolaryngology, we deal with children who've got very simple problems such as ear infections, tonsil infections, kids that get recurrent sinus infections, kids that can't breathe at night because their tonsils and adenoids are so big. And so those are some of the simpler problems, but then we also have children that can't breathe, that have a very narrowed airway. We have kids that have a cleft palate. We've got kids that have feeding and swallowing issues. So those tend to run the more complicated gamut of problems that we see. In the Division of Pediatric Otolaryngology, we also run the cleft and craniofacial team here at Weill Cornell Medicine. So cleft lip and cleft palate requires a multidisciplinary team to sort of work in concert together. We've got a team of over 12 providers that come together to treat these conditions. We have everybody from speech therapists to swallow therapists to geneticists to neurosurgeons to facial plastic surgeons to pediatric otolaryngologists that all work to come up with a common plan for these children. As a result, you don't have physicians working in silos. You have physicians working in concert together to come up with an optimal treatment plan for these complicated kids. We want kids to get back to being kids. Whether it's breathing issues, swallowing problems, sleep issues, we want kids to get back to being who they should be, having fun, enjoying life, not having difficulty with focus. And I think it's one of the cool things we get to do here.